Life course research embraces complexity science, but complex is not complicated.
The participant side of the program was launched nationally in 2018. We really value participants as partners in this program, and so we value to do things like give data back to participants and seek their input on things from our survey modules to how we return results.
Technology is making it easier to collect massive clinical data sets, observations at a global scale about how patients are treated, what drugs they are taking, and what those outcomes might be.
So how do we solve this in large biomedical data? So first, the way that we did it in the first case study to solve the aggregate contribution of each of these phenomenon is leverage a large healthcare insurance claims data set. So here we had millions upon millions of individuals, almost 45 million. And we were able to assess phenotypes by billing codes, procedures, drugs, and labs.
So this national ECHO program has brought together 72 cohorts across the US, representing, I think, 45 states as well as Puerto Rico. So really representing a breadth of and diversity of ages and geography.
If we just look at some of the adult cohorts, these are the cohorts at the top. You can see that each one has had a variety of different examination cycles at different time periods over the course of the past 30 years.
We create first our synthetic population using information from surveys, national surveys. And then we would inform this synthetic population, follow and simulate people over a certain period of time, observe the outcomes and contrast them. And that's basically how you get our impact, basically. As you can imagine here, we're able to expose and unexpose the same people.
But what we lose is that nuance between the two groups where you had the continued low exposure and the high exposure that dropped off. Those, if we had done a traditional analysis, will just get collapsed into the same estimate. And so you'll essentially just collapse over those, losing that nuance of how different patterns and the timing of change of alcohol can affect the outcomes.
In conclusion, we see that life course is a policy relevant topic. And how do you ensure that your work is relevant?
What we need to do is really think about how do we change the way we do our research? How do we change the way we set our research questions to produce more useful evidence that fits into this more realistic interpretation of how things happen in the real world using this systems perspective?
We are positing that we need to move forward together to improve processes and improve applications. To improve processes, we need to integrate data sets across the lifespan. We need to design data science cores that can focus on curation, data cleaning, analysis, and data modeling. And we need new ways to model high-dimensional data. As we move forward to improve application, we need to expand traditional epidemiologic methods to include systems and network modeling and improve reproducibility and standardized measures.